Hello, my name is Laura Salinas. I'm a student at Nightingale College. I'm going to be performing tracheostomy care on my patient here today. I've already verified my provider's orders. I already gathered my supplies, which is tracheostomy kit and clean gloves. I'm going to say that I have normal saline, and I'm going to say I have hand hygiene sanitizer for hand hygiene. I already verified the kit, make sure that it was sealed, non-contaminated, was not tampered with in any way. Expiration is good. We're gonna go ahead and go into our patient's room, knock, knock, provide privacy, hand hygiene, introduce ourselves, identify the patient with 2 identifiers, explain the procedure, let them know what they're gonna be having today. If they have any questions or concerns before we start. I also like to just tell them what I'm gonna have. For example, I'm gonna be having an oxygen machine here because we're gonna pre-oxygenate you prior and have it if your oxygen drops. We're gonna have the suction machine here and ready and available and on if you need suctioning at any time. We're gonna have the pulse oximetry on them to monitor their pulse and their heart rate throughout the whole procedure, and probably a couple minutes after, just to make sure that they're consistently stabilized. We're gonna do an assessment, a cardiopulmonary assessment, check their full vitals right before we even start. We're gonna go ahead and put the bed at our comfort level. We're gonna raise their head at 30-degree angle, as long as there's no contraindications. I'm gonna ask them to take a few deep breaths in between, suction if needed. I already took off the pre-gauze and changed out my gloves. I have all my sterile supplies here and my sterile gloves here. Just to kind of show you, I have everything right here. So I already poured saline in each. I performed hand hygiene before I even put on my sterile gloves and before I did the other stuff. We're gonna go ahead and have our Q-tips in here that are sterile with our saline so they can soak. I have saline on the other 2 little squares. We're gonna go ahead and start with the inner cannula. We're gonna go ahead and take that off slowly. We already explained what we're gonna do. Take that out. I'm doing it. We're gonna go ahead and throw that in the saline. We're gonna clean it with our little brush. We're gonna put it in the other part of the normal saline, let that soak for a little bit to take anything else off. We're gonna go ahead and take that off, examine it, it's good. We're gonna dry it with a sterile gauze, or when it's dry, we're gonna go ahead and put it back in. We're gonna put it in the same way, that curvature. So we're gonna go ahead and go in, let them know, take a deep breath, here we go, in. We'll lock it in place, we are good. We're gonna go ahead and start cleaning around the trach area. So I'm gonna go ahead and start with the top with the Q-tip. We don't wanna just like rub. I'm gonna be very gentle. This is very tender, very sensitive. That's going in the dirty designated area. We're gonna go ahead and do the bottom now. Around, we'll do the sides. Just kind of get in there as much as you can. I like to, since I have plenty of Q-tips, I like to use 1 Q-tip for each side. We're gonna go ahead and grab a gauze. We're gonna pat dry in all those areas. I have plenty of supplies, so I'm gonna go ahead and use another one to pat dry. Just pat dry, make sure I got all of there. So now we're gonna go ahead and change the trach tie. This is a 2-person assist, so we're gonna pretend that there's a 2nd person here holding for me. If not, we're just gonna wing it. So we're gonna go ahead and take this off. If I can take it off. How you doing? You doing great? Great. They're not really talking to me. They're kind of nervous, but they're okay. Our 2nd person is holding that trach in place. We're gonna go ahead and just pull it around very gently. Something is stuck. You didn't hear that. I'm gonna go ahead. I use this ribbon many times. I'm sorry. That is done. They're holding it in place. They're doing fabulous. They're great. We're getting the new one. We're gonna go ahead and go in. I'm gonna tie that with the ankle. We're gonna go around very gently. Be very gentle with them. And so I think one thing that I would like to mention is making sure that it's straight lined back, like it's not twisted or curved, because that really irritates them. Just as much as we can. I know this demonstration is not gonna be perfect, but you would like to make sure that it's straight. I actually have a couple patients that are trach and ventilator, and there's times where I've went and whoever placed it prior, it was actually twisted, and there's friction and redness, and it really does irritate the patient. My patient could not stop coughing because they realized it was different, and they don't talk, so it was something that they noticed that was different. So it's in place, it is tied, it is great. We're gonna say that we only tied one side for now. We're gonna go ahead and put a new gauze over around the area. So we're gonna go straight down, and we're just gonna shimmy it. So we're gonna do one side at a time because you do not wanna pull this trach out. You don't wanna irritate them. They may be coughing in between because of all the movement that's happening. And you just wanna make sure that the gauze is covered at the bottom, closed, and that it's as straight as it can be, just kind of like flared out, because any wrinkles or crinkles, that will also cause irritation. The side that I tied, I am gonna put a gauze just like our instructor did in the video, because that actually does really help to not irritate the skin or them. Sometimes just feeling that is just kind of, so we would just make sure we bend it and fold it away from the patient, so not towards you. And if we had tape, we would just tape the two ends together, not on the patient, just together on the side. And that's how it would look, so pretty. We would gather our supplies, throw it away, designated dirty area. We would leave the post ox on for a couple more minutes. I mean, I would personally, just to make sure that they're okay, they're good, they're stabilized, ask them if they're okay. Make sure that we put our patient's bed back to where it was before we leave. Open the curtain to open it back up. Perform hand hygiene, go document what we did, the procedure, how they tolerated, because I feel like a lot of people don't put that they tolerated good or well, or if there's any discomfort or irritation, because those are really good signs of anything new. And if how the stoma looked just like around the area, if there's any redness, any new cuts or abrasions, any new irritations, anything different that I added. So if I had to add ointment, if I had to add more gauzes than normally, anything at all new or different, I would document all that. Of course, any emergency issues or anything severely new, I would notify the provider right away. Thank you.